Hello everybody and welcome to Surgery School. My name's Dr Claire Moore and I'm a consultant anaesthetist at Wythenshawe Hospital and I'm the lead for the ERAS Plus project. Thank you for joining us. I suspect the reason you're watching this presentation on the internet is because you've not been able to make our virtual surgery school that we're currently running in place of the face-to-face surgery school because of the COVID pandemic. I'd like to welcome you all to Surgery School. And we will move forward with some slides for you to look at. Also part of the presentation today will be our physiotherapist Barbara, who will be telling you all about the role that the physio plays as part of your hospital admission. And you'll also meet Bina, who is our enhanced recovery nurse, who you will also meet when you come into hospital. So the ERAS Plus project stands for Enhanced Recovery After Surgery. And I'd like to spend the next half an hour or so talking about how you can prepare for your surgery and how you can recover from your surgery afterwards as well. We also have a website called erasplus.co.uk that contains all the information that we're going to discuss as part of the presentation today that you can look up after yourself to get more information if you wish to. Before we start discussing about preparation and recovery from surgery, I just briefly want to mention about COVID and how the hospital has adapted in the last few months to the way things have to be due to the COVID pandemic. For those of you that have already had your pre-op assessment, you will have noticed that as soon as you come into the hospital, you'll be asked to wear a face mask, and all our staff will be wearing face masks as well. This is to protect you and to protect us from COVID. We will also run a COVID test on you prior to your admission from hospital, generally about 48 hours before you're due to come in for your surgery. You will also be asked to isolate prior to your upcoming surgery. Current guidelines ask you to isolate for either 72 hours or 14 days prior to your surgery. The one that you get asked to do will very much depend on the sort of surgery you are having and your past medical history, and your surgeon will have assessed both those and made a decision as to whether you fall into the group that needs to isolate for 72 hours or 14 days. That isolation means you should stay at home as much as possible unless you absolutely have to go out for shopping, but we'd like you to stay in your own house with minimal contact with other people to try and avoid you catching the COVID virus prior to you coming in for hospital. We have developed pathways over the course of the last few months to keep you safe during the COVID pandemic. And as part of your consent process for surgery, your surgeon will discuss with you what the risks of COVID are when you come in for surgery. Hopefully this will all reassure you that we can look after you safely during this time of your surgery. We want to help you prepare and recover well from your surgery. You're all here because you're all having major surgery of some sort in the coming weeks. Many different sorts of surgery. Some of those surgeries may be for cancer, some may not be. Some of you may be having surgery on your lungs, your livers, your kidneys, your bowels, many different types of surgery. But all those operations are fairly big operations. And the one thing that you have in common is that you will hopefully all benefit from some advice about how to prepare and recover from your surgery. We're well aware that at this time, many of you will be feeling very anxious about your operation. And often our patients tell us that they feel like a little bit like they're on a roller coaster and they're not in control of their surgery. They're coming to hospital for an appointment, for a scan, and suddenly they've been given a date for major surgery and they feel a little bit like they're on a roller coaster. What I'd like to try and do over the course of the next half an hour or so is give you a little bit of control back of your own surgery. Help you to understand the things that you can do that will really make a difference to your outcomes from surgery, that will make you feel like you have a lot more control back and make you feel in charge of your own surgery. Surgery is a big stress for your body, but you can prepare for it. For a moment, I would like you all to imagine that instead of having surgery in a couple of weeks' time, you're going to run a marathon instead. I know that seems a little bit crazy, but just bear with me for a minute. If you and I were going to run a marathon in 2 weeks' time, I strongly suspect that we would both be thinking that we need to prepare for this marathon. Every day between now and then, we would go out and get some exercise. We would do some training runs. We would build up those training runs over the course of a couple of weeks to ensure that our body was physically prepared for that marathon. We would also be thinking to ourselves that nutritionally, we need to pay attention to what we're eating over the course of the next couple of weeks to ensure that our bodies have enough calories on board for the marathon. Because both nutrition and preparation physically are really, really important if you're running a marathon. And they're also really, really important when you're undergoing major surgery, because the thing that surgery and a marathon have in common is that they both put a big stress on your body. For both of these things, your heart has to work harder, your lungs have to work harder, your kidneys have to work harder. And in the same way as you would benefit from preparation for a marathon, the same is true for surgery. So that's part of what I'm going to spend a bit of time talking to you about this morning. The 4 main things that I want to discuss with you, as the slide shows, are activity, chest training, nutrition, and also not forgetting family and friends, because family and friends play a huge role in helping support you through surgery. And the really important thing about family and friends is they want to be there to do it to help. So if you can get your family and friends to watch this video as well, it will help them to help you, because it will help them to know what they need to do to help you through your surgery. Before we move on, however, I've got an important slide just to briefly discuss with you about smoking. Many of our patients that come in for surgery at Wythenshawe are smokers, and we've developed over the last few years, along with our respiratory colleagues, a programme that we call the Cure Project. This has been set up to help our patients stop smoking around the time of surgery. We know that smokers have a higher risk of chest complications. That's things like chest infections after surgery. So if you can stop smoking before your surgery, it will make a difference. And our team of nurses from the Cure Project are there to help you stop smoking. So if you would like some help with that, please ask your pre-op nurse when you come in for your pre-op appointment, or ask your specialist nurse to put you in touch with the Cure Project team, and they can help support you coming off smoking over the course of the next few weeks before your surgery. I also briefly just want to mention alcohol. Alcohol can depress your body's immune system, and your immune system is really important during the time of surgery to help you fight infection. So we ask all our patients having major surgery to reduce or even stop their alcohol consumption for the whole of the perioperative period. So that means for the next 6 to 8 weeks. If you drink perhaps only 1 or 2 glasses of wine a week, then that doesn't cause a problem. But if you drink alcohol regularly, perhaps every day, or you drink a little bit more than you know you should, you're in the group of patients who are asking to try and reduce or try and stop, if you can, that alcohol consumption around the time of surgery, so as to give your body a boost to make it as strong as possible, so that if you were to incur infection around the time of your surgery, your body is more equipped to cope with that infection. And then finally, at your pre-op appointment, you will have some blood tests that will check that you're not anemic. Anemia means that your blood count is a little bit low. And ideally for surgery, we want your blood count to be optimised as much as possible. So if you are anemic, our pre-op nurses will contact you and arrange for you to come into hospital for an iron infusion before your surgery to optimise your blood count before you have your operation. So just a little bit of a background about why we started the ERAS Plus project in the first place. So about 7 or 8 years ago, a team of my colleagues started looking at surgical outcomes from surgery at the Manchester Royal Infirmary. And they looked at a large cohort of patients that were having surgery similar to the sort of surgery that you're all having. Patients having operations on their lungs, their livers, their kidneys, their bowels. And they looked at what the outcomes were from those surgery. And they noted specifically the number of people that got a chest complication after surgery. And when I say chest complication, what I mean is people who get a chest infection, people who need antibiotics for their breathing, people who need oxygen therapy after their operation, specifically because of a problem with their chest, or people whose hospital discharge is delayed because of a chest infection. And they noted that round about 20% of people after major surgery were getting these complications. And actually this wasn't that unusual. We looked at national data and international data, and our outcomes in Manchester were fairly similar to elsewhere. However, we realised that this was far higher than we wanted it to be. So the whole ERAS Plus project was designed around trying to reduce complications from chest infections after surgery. And this project was then rolled out, part of which was surgery school, which is what we're doing now, along with a pathway of care that you will receive when you come into hospital, aimed at trying to reduce chest complications for our patients around the time of surgery. And over the course of 2 or 3 years, as this became embedded in our patients' care for every patient, we noted that the outcomes had improved. And as you can see on the graph there, we measured our incidence of chest complications afterwards and before. And at the end, we noted that the incidence was just under 10%. So it had dropped by almost half from the beginning. We also noted that the average length of stay in hospital had dropped from about 9 days down to about 6.5 days. So with this pathway, people were recovering quicker, they were getting out of hospital quicker, but there was also a statistically significant difference in the incidence of chest complications after surgery. So this was really good. And we published this data, and following publication, we managed to secure funding to roll this project out for the whole of Greater Manchester, so that wherever you are in Manchester having major surgery, you should receive a pathway similar to the ERAS Plus way that we're running at Wythenshawe. So that's the background. Now I'm going to tell you what you need to do as part of the pathway. So the first thing that I'd like to talk about is about activity and muscle strengthening. As we discussed before about likening your surgery to a marathon, I'd like you all to try and prepare physically for your surgery if you can. We know that the fitter you are, the less likely you are to develop complications after surgery. So rather than just taking you as you are today and saying, right, let's just carry on and do an operation, we want to try and give you the opportunity to get as good as you can be before we undertake surgery. But we also appreciate for many of you, we've got a time factor in that some of you may actually be having surgery next week or the week after. There still is time in that short space of time to get you a little bit fitter though. So what I'm proposing to you all is that every day from today, you all start to undertake 20 to 30 minutes of activity every day. Now that activity can be something that suits your baseline level. So we may have some patients having surgery who use walking aids or who are perhaps in a wheelchair, who can't go out walking. But indeed, we may have people having surgery who are significantly fitter than that. So the 10 to 20 minutes of activity I'd like you to undertake obviously has to be something that is suitable to your baseline. So it could be going for a walk, it could be cycling, running, hoovering, dancing. It could be simple exercises at home, as simple as doing squats, leaning on the kitchen cabinets. You could get a couple of bags of sugar and do some exercises with your arms. Something that gets your heart rate up, something that gets you a little puffed out so that you know you've done some activity. And if you want to split that 20 to 30 minutes into 2 lots so that you do 10 to 15 minutes in the morning, 10 to 15 minutes in the afternoon, that's fine. But I'd like you to try and do that every day from today until the day of your surgery. And there's actually evidence that shows with some regular activity like this, within a couple of weeks, you can build a little bit of muscle mass in your body. And this is a good thing, building you up a little bit before surgery. So just briefly on this next slide is the link to Prehab for Cancer. Some of you may have been referred to the Prehab for Cancer programme. Some of you may not, but if you have a look on the Prehab for Cancer website, there is a link to some videos that will show you examples of different types of activity that you can do in your own house, because I appreciate that during the period of isolation before your surgery, it's very difficult to go outside the house to exercise because we've asked you to isolate. So on this link, there is some examples of different exercises you can do at home to fulfill that 20 to 30 minutes of activity every day that we're asking you to do. I'm going to move on now to talk about chest training. So the chest training part really relates to trying to reduce your incidence of chest complications after surgery. I'm going to start with a little bit of basic physiology about breathing, because it's important that you understand that so that you can understand how we're trying to prevent chest complications. When you come in for your operation, somebody like me or one of my colleagues, anaesthetists, will put you to sleep for your surgery. Before you go to sleep and have a general anaesthetic, your lungs generally fill your chest cavity. They're big and they're full and they're fully expanded. But after 3 or 4 hours under anaesthetic, the bases of your lungs tend to collapse down because a breathing machine is not as efficient as you are yourself at breathing. And also, when you're under anaesthetic, you don't cough. And coughing is a natural mechanism to clear the secretions from your chest. And we all actually cough every day, round about a pint of secretions off our chest. Now that sounds a bit yucky because we don't spit them out and look at them. That pint of secretions that we cough up off our chests, we cough into our throat and then we swallow them. And those secretions go down into our stomach. And any bugs or bacteria that are in those secretions get killed by the gastric acid in our stomachs. So on a normal day-to-day basis, those secretions don't cause us a problem. However, after surgery, when you wake up from your anaesthetic, the bases of your lungs tend to be collapsed down a little bit because you've not been coughing for a few hours. And the secretions in your lungs tend to be a little bit stickier and are quite difficult to clear after your operation. And that's confounded by the fact that after surgery, when we ask you to cough, most patients will just go and they don't cough properly because it hurts. So in a moment, our physio is going to teach you some great exercises to cough after surgery that are really efficient at getting those secretions up off your chest. ICOF is a mnemonic that goes through the 6 elements of the important things that you need to do to try and help prevent chest infections. Incentive spirometry is one of them, and Barbara, our physio, is going to show you that incentive spirometer in a few minutes, and she's also going to go through some coughing exercises with you. Oral healthcare as part of that is actually really important. Now, oral healthcare, what I mean is brushing your teeth and using an antibacterial mouthwash. I talked just a moment ago about secretions dripping down into your chest after surgery and potentially having bacteria in them. Those secretions start off in your mouths, and everybody's mouths have bugs and bacteria in them. I'm not suggesting that any of you have dirty mouths, but we all have bugs and bacteria in our mouths. And often when our patients get a chest infection after surgery, the bug that causes the chest infection is a bug that started off in our mouth to start with. It's unusual to catch a chest infection in hospital. So it would make sense, therefore, that if we pay attention from today, in brushing our teeth or our dentures twice a day and use an antibacterial mouthwash, so something like Listerine or Corsadil or Sainsbury's own brand antibacterial mouthwash, if we use that twice a day after brushing, every day from today, all the way through your hospital stay and afterwards for the whole perioperative period, so that's for like the next 6 to 8 weeks, as part of this pathway, that will help reduce your incidence of chest infections after surgery. So paying attention to oral healthcare is an important part of the process. The U of ICOF stands for understanding, and that's why we've asked you to watch this video today, so that you understand all the important things that you can do for yourself that will make a difference to reducing chest infections after surgery. We consistently get feedback from our nurses on the surgical wards that they can really tell the difference between our patients that have attended surgery school and those that haven't managed it. Because those of you that come to surgery school and watch this presentation and understand the important things you need to do for yourself are much more motivated and dynamic in that first few days after surgery. It will really make a difference. The G and the H of ICOF stand for getting out of bed and head of the bed elevation. So some of you may have heard of the term pyjama paralysis. Pyjama paralysis is the traditional belief that when one comes into hospital, one puts on their pyjamas or their nightie, and then they get into bed and they sit there in bed and wait for things to happen to them when they're in hospital, because that is traditionally what has happened to people when they come in for surgery. I want you to take the term pyjama paralysis and throw it out of the window, because surgery these days, the recovery from surgery, is an active process. It's not about resting and being mollycoddled in your bed. On day one post-op after your surgery, we will get you out of bed. We have a goal at Wythenshawe where we aim to get 100% of patients out of bed on day one after surgery. Okay? Occasionally, we don't quite manage it, but for most of you watching the video today, we will aim to get you out of bed on day one post-surgery. And that's for a number of reasons. And one of them specifically relates to avoiding chest infections. It's so much easier to cough properly and to take a deep breath if you're upright than it is if you're laid in bed, because the weight of your tummy isn't pressing against your chest. So that's why we want you all up and out of bed after surgery, so that you can cough and do your breathing exercises properly. It's also really important to get you up and mobile to help prevent blood clots. So that's another important part of it. Getting out of bed and head of the bed elevation are all about, again, keeping your lungs big and healthy and clean and preventing chest infections after surgery.
Hi, my name is Barbara. I'm a respiratory physiotherapist. I'm here to explain to you what's going to happen after your surgery. This is because a lot of patients are really worried about seeing us after surgery. They worry that we're going to make them exercise really hard, and we're not going to do that, don't worry. Some patients, on the other hand, are really happy to see us because they think we're going to massage them. So do not ask for a massage, because that's not going to happen. What we're going to do with you are very simple things that are going to help you in your recovery after surgery. These simple things that we're going to do, despite the fact they're very simple, they've been proven to be very effective to recuperate better after your surgery and going home safer. So the exercises that we do, first of all, are called active cycle of breathing technique, and they're designed to clear your chest from secretions. When you're in surgery, you're going to be sent to sleep, and you're going to be on a ventilator. All the time that you've been on a ventilator, you're not going to be able to take a big breath or expectorate to do anything like that. So you're going to have a bit of build-up of secretion on your chest, and the base of your lungs are quite squashed, so that they're a bit of a collapse on the base of your lungs. So this exercise are going to help to get rid of secretions and to expand your lungs again. You can use these exercises even if next year you're going to have a bit of a chest infection with a bit of secretion, so you can get rid of these secretions. I'm going to explain that to you now. So follow me. So sit up on a chair, shoulders floppy, hands on your lap, palm facing up. Take a big breath in and hold it in, counting to 3. 1, 2, 3, and breathe out. And again, a big breath in. 1, 2, 3, and breathe out. And again, repeat. Big breath in. Try not to lift your shoulders. Try to take a big breath in and push through the base of your lungs. Big breath in. 1, 2, 3, and breathe out. After that, you need to breathe a couple of times, just normal breaths. And then we're going to ask you to do a big huff, like when you steam a mirror or when you clean a pair of glasses. So mouth open and and repeat. And repeat, like really pretend you clean a pair of glasses. So after that, we're gonna give you a towel and we're gonna ask you to cough. So depends where you had your surgery. Some people gonna have thoracic surgery, some people gonna have surgery on their tummies, some people gonna have surgery on their heart. So you're gonna hold the towel wherever you got a cut there. So you're gonna hold and we ask you to cough. So I'm not gonna lie to you, it's not gonna be as easy to cough after your surgery. It's gonna be a bit uncomfortable. However, we need to do it. It's better for you because the sooner you do it, the better you become, the sooner you'll get better. Sometimes you're gonna feel after your surgery, you're gonna be a bit like tired, a bit groggy, a bit upset. And we're gonna come across as being a bit, insisting, but we need to do it with you. We're not gonna do this for our benefit, but it's for your benefit. So work with us, please. We're gonna ask you to walk as well. Don't worry if you got a catheter, if you got some drip stand or anything, we can make people walk on a ventilator. So having a catheter or drip stand is nothing for us. We got frames, so we can hook everything on a frame and we can walk with you. It's very important to walk because it keeps your circulation going, and automatically when you walk, you take big breaths. So that's gonna expand your chest as well. About coughing, do not worry about rupturing the surgery, the stitches, because the stitches are not simple things. They're very strong, and they're not gonna rupture when you cough. So don't worry with that. So before you go home, we're gonna ask you to do the stairs. However, some people are so good on their feet, we do not need to see them on the stairs. So don't worry about that. If we see that you're a bit unsteady, if you got some problems, then yes, we're gonna see you on the stairs, but that's not a given. If you're fine, you're fine. Then we're gonna ask you to use the incentive spirometer. So this is a simple thing. There are two types. They got a mouthpiece. What you need to do, you need to put the mouthpiece, mouth, and suck the air in. So there is another type, there's a bit different. With this one, you have to be quite forceful when you breathe in. So, and keep the balls up for a couple of seconds. This one is a bit different. You don't have to be so forceful. What you need to do, you just basically need to take a prolonged breath to keep the yellow bit at the top. So I'll show you. There is a yellow cap there. You take a big breath in, prolonged, and you keep the yellow cap on that transparent bit. So that's it. I hope you understood everything. This is just a taster. Obviously, we're gonna see you after your surgery. This is just to show you what's gonna happen so that you got a rough idea what's gonna happen after your surgery and why you will need to see a physiotherapist. Do not worry, everything is gonna be explained again. Thank you.
So now we're going to talk about nutrition for a few moments. I did mention earlier that if we were running a marathon in a couple of weeks' time, it would be important to pay attention to what we were eating. Because when you run a marathon, your body needs to have lots of calories on board in order to have enough energy to run that marathon. And the same goes for your surgery. We do know that patients who are a little bit overweight, so with a BMI of between 25 and 30, have slightly better outcomes from surgery than those that are perhaps underweight. And this is probably because they have a little bit more reserve on board, and your body needs those reserves to call upon after your surgery. We know it's important after surgery as well to start eating and drinking quite quickly after your operation, because inside your body is still running a marathon. So it's important to feed yourself after that operation. So I guess what I'm trying to say is, over the course of the next week or 2 weeks or 3 weeks before your surgery, I don't want you crash dieting and trying to lose a few pounds if you're a little bit overweight for your surgery. Now is not the time to do that. I want you to eat well, ensure you have all the important nutrients and vitamins, the carbohydrates, the proteins and the fats. that would be present in a normal balanced diet over the course of the next couple of weeks, so that your body is as well nourished as possible when you arrive for your operation. For those of you that have already attended your pre-op appointment, you will have been given these pre-op drinks. These pre-op drinks are calorific drinks that we use to prepare you in the last 24 hours before your operation. They are quite high in sugar, however, so if you've not received these, it may be because you're diabetic. We don't tend to give them to our diabetic patients, but everybody else will have been given them. If you're diabetic, we do things slightly differently for you, so don't worry, you won't miss out. For those that have been given these drinks, you will have been given 6 of them. Apparently they taste much nicer if you pop them in the fridge first. They're a little bit like a flat lemonade. 4 of them I would like you to have the day before your operation, along with your normal food. So I would suggest if you start around lunchtime and have one with your lunch, have another one mid-afternoon, have one with your tea, and have the last one before you go to bed in the evening. If you don't manage every single last drop, it doesn't matter, just do your best. And then on the morning of surgery, I want you to have the last 2 drinks at about 6:30 in the morning, along with all your normal medication that you would normally take on the morning of surgery, unless there's a specific tablet that you've been told to withhold by the pre-op team. After your operation, as I mentioned before, it's important that we get you back to eating and drinking quite soon after the surgery. But unfortunately, frequently our patients don't have a lot of appetite in that first 24 hours. And this is often because you've had major surgery, and partly because of the drugs that we give you as part of the anaesthetic. So we find that people's appetites are diminished for 24 to 48 hours. That said, I want to try and encourage you to eat and drink a little bit in that first 24, 48 hours after your surgery, because your body is still running a marathon inside. So it's important that you get nutrition on board. So I would suggest little and often. Try your best to have what is given to you from the nurses on the ward, because your body will need it. It will need those nutrients. And in order to do all the things that we're asking you to do with the coughing and the breathing exercises and getting out of bed, you will need that nutrition on board. For some people after surgery, we prescribe these post-op drinks called 40 juice and 40 sips. Not everybody gets them, because not everybody needs them. They're more frequently given to patients that have bowel surgery or surgery on their bowels. If your surgeon feels that you need a bit of a boost in the number of calories that you're receiving because you're not quite managing to consume enough calories, they may prescribe these for you afterwards. There's different flavours. There's a milk-based one and a cordial-based one. So if you are prescribed these, try your best to have them. They will just give your body that calorific boost it needs for generally just a short number of days after your operation, and they will help contribute towards recovering well. So now I briefly just want to talk about pain relief after surgery. Pain relief is incredibly important, and your anaesthetist will see you on the morning of surgery when you arrive in admissions lounge and discuss specifically with you about the operation you're having and the sort of pain relief that you will need. They may talk to you about an epidural, which is where we put a small needle in the lower part of your back before you go to sleep and thread through a tiny little plastic tube. The needle comes out, the little plastic tube stays there, and it can stay there for a few days, and we put painkiller down it in order to provide good pain relief around the area where you're having surgery, be that your chest or your tummy. Not everybody needs an epidural. We may talk to you about having a wound infusion catheter, and this is where we put a tiny little plastic tube either side of wherever your wound is, and we put some local anaesthetic through there, which can help provide good pain relief around the site of your wound. We occasionally use a machine called a PCA, which stands for Patient Controlled Analgesia, and this is a syringe full of painkiller with a drug similar to morphine in it, and you get a button to press. If you keep pressing the button continuously, it won't keep giving you medicine. It has got a safety lockout mechanism on it, but it will give you a dose once every 5 minutes maximum when you press the button, which will allow you to administer yourself your own pain relief on that night post-operatively if we anticipate that you're going to be sore. All these devices work very well. However, being attached to an epidural or a PCA post-operatively does somehow encourage a little bit of pyjama paralysis, and that's what we want to try and avoid. So if you are given one of these things for pain relief, often we only leave it with you for 24 to 48 hours or so, and we would then rapidly move you onto oral painkillers, which are tablets that you can take by mouth, in order that we can then mobilise you and get you up and out of bed after surgery. For a lot of you, from the first part straight after the operation, we will put you directly onto oral painkillers anyway, without the epidural and without the PCA. And we have lots of really good painkillers in the hospital that you swallow by mouth. One of the ones that we use frequently is a drug that has what's called a modified release action. So you take a tablet in the morning and it releases its duration of action throughout the course of the day. You take another at bedtime and it does the same throughout the night to give you a balanced regime of pain relief throughout the course of the day. We will also prescribe what we call breakthrough pain relief, and this is often prescribed in the form of a liquid, and this can be taken at any time when you ask for it. If you need that just extra little top up of pain relief, you must ask the nurses on the ward. It's really important that you have enough pain relief on board, because if you're too sore to cough and you're too sore to get out of bed, everything that we've just talked about for the last half an hour will be a complete waste. Pain relief is the key to be able to get out of bed and cough and take deep breaths after your surgery. So if we haven't prescribed enough for you, please ask for a little bit more. We will try our best to get it right, but occasionally if we haven't prescribed enough, you must feed that back to us so that we can make things right. So moving on to recovery then, this is the bit for when you get home. This graph is meant to represent an idea of what your first 6 weeks will be like after surgery. It's good to have a goal of when to expect to get back to baseline, and for most people after major surgery, 6 weeks is a reasonable plan to try and get back to baseline in. Some of you will recover quicker than that, some of you will take a little bit longer. But if we plan for 6 weeks, that will help you know that day by day when you get home, you need to build up your activity. So I want you to be up and dressed and getting some exercise every day, and building that up every day, getting back towards what your normal baseline of activity was, and using your friends and family for help and support as part of that. So lastly, just to summarise again, the 4 things that we've discussed this morning are about activity and how important activity is as part of your both preparation and recovery from surgery. We've discussed in detail about chest training, and Barbara, our physio, has gone through the different exercises that we would like you to do to try and help you avoid getting a chest complication post-operatively. We've talked about nutrition and how important nutrition is as part of your preparation and recovery from surgery. And not forgetting your family and friends. Hopefully, if they've watched the video as well, they will now understand what their role is to try and help you prepare and recover from your surgery. I'm going to hand over to Bina now, who is our enhanced recovery nurse, and she's going to go through some important information about your admission to hospital. From my part, I would like to wish you the best of luck with your surgery, and I may meet you when you come in if I happen to be your anaesthetist. Thank you for watching.
Hello, my name is Bina Thomas. I am the Enhanced Recovery After Surgery Specialist Nurse. I am going to talk a few bit about what to expect when you come in for the surgery. Most of you will get admitted to the hospital on the day of surgery. Very few of you will get admitted the day prior or a week prior if your surgeon feels if you need any kind of optimization in terms of nutrition or to balance your blood sugar. But otherwise, you come into the hospital on the morning of surgery. You may have received a letter stating where exactly to report and what time you're supposed to report to the hospital. Once you come into the hospital, you will be met initially by your surgeon, who will discuss the surgery a bit more in detail, and if you have any last minute queries, you can go through the surgeon, and if any of the paperwork is remaining, like consent, that will be taken care of. You are seen by your anesthetist. They will discuss the kind of anesthesia, and they will also discuss the kind of pain management they are planning with you. you can always ask them questions about what kind of pain management they are thinking about. Thirdly, you will be seen by your pre-op nurse. They will take your basic parameters like your blood pressure, heart rate, everything. And then they will also take your ankle measurements to give you something called as DVT, that is deep vein thrombosis stockings. These are compression stockings, which are basically one of the prophylactic or preventive measures which we do to prevent blood clots. Developing a blood clot is one of the complications of major surgery, and we do some steps to prevent them. And one of them is DVT stockings, which go on your legs, and they are below knee stockings. They are very similar to your flight stockings. The second thing which we do to prevent blood clots is something called as sequential compression device or a flowtron. This will go on your legs while you are on the OT table, and immediately after surgery while you are on the ward or on the high dependency unit. This is basically like a garment which goes on your calf muscles with the help of a Velcro, and that is attached to a machine that manually pumps your calf muscles so that it mimics walking. Since we are not expecting you to get out of the bed as soon as you come out from the surgery, we are making sure that we are doing everything possible to prevent blood clots. The third thing which we do to prevent blood clots is Clexane injection. Is one of the blood thinning medications that is given to you while you're in the hospital by your nurses. This is given once in a day, and this injection usually goes in your tummy. Some of you may be going home with these injections for 28 days, but if in case that happens, we will give you enough training before you go home, how to do the injection on your own. Now let's talk about what all things to get to the hospital. Please don't get big luggages to the hospital. We have very limited space here. So I'm just going to give you a list of things what you need to get to the hospital. The first being the spirometer, which is already posted to you. And don't fret if you haven't received one. We'll give you one while you're in the hospital if you haven't received it. So if you have received it, please keep it in your bag. The second thing is toiletries. Again, you need to get your brush, paste and the mouthwash. We have already discussed about the importance of mouthwash. So that needs to continue even after you come to the hospital. Again, if you forget your mouthwash, that's absolutely fine. We will give you one from our hospital. But though I have not personally tasted it, I'm not sure how many of you will like the strong taste of it. So you're free to get your own mouthwash and all the other toiletries which you usually use. The third thing is about the dressing. You can have like one pair of day dressing and one pair of night dresses. But if you're comfortable wearing the hospital clothes, you're free to wear the hospital gown. I would recommend personally to wear a hospital gown on the initial day, because if you have some lines and catheters, it becomes easy with the hospital gown. But on day 1, now what is day 1? Day 1 is the next day of surgery. Day 0 is the day of surgery, and hence so on and so forth. So on day 1, if you want to move around in your own clothes, you are free to do that. Regarding bath towels and hand towels, please don't get any towels to the hospital. The logic being that you don't have any space to dry them, and if you are going to store the dirty towels, then it may cause more infection. So please use the hospital towels, hand towels and bath towels so that it can be chucked straight away in the laundry, and then you can use a fresh pair whenever you need another one. The last is about your medications. So medications wise, please get all your medications in the original boxes. Why I say is, nurses cannot give you any medications on your word. We need to know the name of the medicine. We need to know the expiry date of the medication. So if you want us to continue the same medicine which you're taking at home, it is better that you get the medications within their original box. Now, if you have only blister packs, get them anyway, and we will try to take the prescription down, and with the help of the pharmacist, we will order it from our pharmacy. But if you have original boxes, medications at home, it will be worthwhile to get it to the hospital. The next thing I want to discuss is about the infection control. So it becomes all the more relevant in the era of pandemic. So make sure that you are using soap and water for hand washing. You are using your alcohol gel. Regarding the mask, as soon as you enter the hospital, you will be required to wear a mask. While you are in the corridor, while you are going to the theatre, you will be required to wear a mask. But while you are inside the hospital or inside the ward or high dependency unit, as an inpatient, you don't need to wear a mask. But you will see all the healthcare professionals wearing a mask. If you are in the hospital for less than 7 days, unfortunately, in this current period, we are not allowing any visitors. But if you are in the hospital for more than 7 days, we do allow one visitor for an hour. So we can discuss which visitor you want to come and the timing, and that can be arranged. Again, there's a disclaimer. The policies keep changing on daily basis, so I can't say that this will be true when you come in. But as of now, we are allowing one visitor after 7 days. And you will be seeing all the healthcare professionals wearing masks around you, and the healthcare professionals in your ward are being screened regularly for COVID. So you don't have to worry that there will be any healthcare professionals who are not screened. And if you are in the hospital for more than 7 days, you will be again swabbed. We will collect COVID swab again, and you will be tested on regular basis. Okay, so this is about the basic things which I wanted to say. From my personal experience, because I go and see all the patients on the first day after the surgery, what I have seen from my experience is the two main enemies for all your mobilization and all this plan is your pain, and second is your nausea, vomiting. So from my experience, what I want to say is you don't have to be brave. If you are in pain, please let us know. Because apart from the regular medications, you have something called as and when required medications which can be given. They are fast acting. They can be given every 2 to 4 hourly. And if we think you are not able to control your pain or manage your pain with the medications we are giving you, we will make sure that we refer you to the pain team. They are an expert of specialist nurses and an anesthetist. They can come down and they can review your medications, and then they can give you the correct medications to help you with your pain. So the baseline is, please make sure to verbalize your pain. And secondly, also remember that these are controlled medications and they require 2 registered nurses to actually go to the cupboard and open it and sign and take it out. So my suggestion is that don't wait for your pain to reach on 10 on 10. So usually you're asked to score your pain from 0 to 10, with 0 being the least and 10 being the highest. So my point is, if you wait for the pain to reach on 10 on 10 and then ask for pain relief, it may take a bit of time for the nurses to get the medications to you, and all your mobilization plan will go out of the window. So please make sure that you're verbalizing the pain to us. Second is about nausea, vomiting. If you think you're having nauseous feeling all the time, you're feeling like vomiting, apart from the regular anti-sickness medications, we have as and when required medications that will be given to you. Please verbalize whatever you are feeling. Thirdly, about the supplemental drinks which we are giving you, post-operatively the supplemental drinks which we give for your nutrition, they come in 2 forms. That is, one is milk-based and one is cordial-based. If you don't like the milk-based supplement, make sure you're asking for the juice one. And then you have a variety of flavors in them. So you can ask for different variety of flavors, and you don't have to drink all the bottle in one go. You can sip on it, and that it makes it a bit more easier for you to go ahead with it. That's all I wanted to say. All the best for your surgery and take care. Thank you.